Now, I have the wonderful pleasure of welcoming nurse researcher and professional Dr. Dzifa Dordunoo to present findings from the CNA's collaboration with the University of Victoria on anti-racism. So, welcome. Thank you so much for joining us.
Thank you, Kim, for that welcome. And I am trying to share my screen. Greetings, everyone, and thank you all so much for joining in today. Thank you to CNA and the Anti-Racism Committee for the invitation to be here today to give you an update on this multi-year project that we're working on entitled Tackling Racism and Discrimination in Nursing, in nursing. I'd like to acknowledge that I'm joining you from the traditional and ceded territory of the Lekwungen people here on the Coast Salish Sea. I also like to acknowledge that CIHR had funded the study, but they had no input whatsoever in the conduct of the study. And CNA is specifically Mr. Mike Villeneuve was the nominating principal applicant of this project, and they have been involved in the study and have in no way tried to suppress anything. So all the information that I have on the research, happy to share that with you. In the time that I have today, I may not be able to do justice to it, but feel free to send me an email if you have additional questions that you want to discuss. So my plan for today, I was asked to include a group activity. And so to get to the group activity, I'll give you a little bit of background information on the project, and then I'll get into sort of the meat of the presentation, which is the findings of our phase 3 of our project. For those of you who were not able to join in the summit the last time, I believe it was 2022 now, I'm losing track of time, but you can use a QR code here to hear that presentation, which is available on CNA website. Like I said, it's a multi-phase project, but if you listen to the presentation, you'll get a fulsome understanding of where it came from and why we got to where we are. So for the research question for that phase 3 are really about looking at what is the prevalence of discrimination at the workplace among nurses in Canada. What are the impact of this workplace discrimination on the nurses? And then the strategies. The strategy piece, again, like I said, just not enough time to get into all of those things, but I will thread it through as it apply as I go through the presentation. The inclusion for the survey was self-identified nurses, regulated nurses in Canada. And the way we had designed the survey, we designed it as such that certain questions would include people. So anybody can say they're nurses, but how do we know that they're regulated nurses? We're looking at their educational level and all of those things. So we're pretty confident that the respondents were in fact regulated nurses in Canada. The survey was available in French, both French and English, and link was circulated through CNA and other professional network. So this project is really about your story, my story, all of our stories. So that's exciting, I suppose. So just to lay some foundation for the group activity, when we were designing the study, we used the human rights codes to inform the study. And the reason why we chose this approach was because we want this to lead to action. So this is not about getting a publication or getting a grant or any of those things. We all, including yourself, myself, and all of us, really want changes in our profession. So the idea was that if we could establish that there are violations of human rights, nurses' human rights, that should move all of us, individual, society, and organizational level, to take actions to combat it. Because if the nurses are not well enough, they can't do the work that we as the global we expect them to do. So we use a definition from the United Nations to inform our study. And that definition's right here is very similar to other definitions that you may have heard, but is really about the socially constructed ideology that assigns certain groups or ethnicities to higher positions of power. And that obviously has ramification for all sort of things, including health disparities, how nurses are able to practice their profession or not. So again, that was the reason why we chose the human rights angle. And in sticking with that, within the human rights mechanism or instruments, racism and racial discrimination are two separate things. I'm not saying one is better, one is more severe or important than the other. That's not what I'm saying. Just saying that under the code, there are distinctions between racial discrimination and racism. And so racial discrimination in the UN Human Rights Code says that there are three elements that establish racial discrimination. One is that there are prohibited grounds. These are race, color, descent, nationality, and ethnicity. Notice that in that protected grounds, race and color are used and they're not interchangeably. Several years ago, I had, I was doing my fellowship at the UN, and I asked that question: how is race defined or taken up in these regulations? And the answer I got was that race was taken up as caste system and not class, caste system. So they're, race, color, descent, nationality, and then ethnicity. Those are the protected grounds or prohibited grounds for discrimination. There needs to be, in order for racial discrimination, for the second aspect of racial discrimination, there have to be differential treatment. And that differential treatment has the purpose or the effect of impairing the person's rights and freedoms. The challenge, I will hopefully get time to describe that, to talk about that later, is that, nurses need to establish that nexus, saying that your protected class is the reason why you're being treated the way you are being treated. And as you know, racism and racial discrimination is very subtle and implicit. So how do you go about establishing those grounds within that human rights framework? That's a conversation for another day, and I might touch upon it later if we have time. So in terms of racial discrimination, there are also different forms of this racial discrimination. We talk a lot about this in the report that we published for the first two phases. And so the two different types of racial discrimination are de jure and de facto. De jure refers to the racial discrimination that is embedded in official laws and policies. And, using immigration as an example, there were rules and laws that kind of prohibited people from certain countries from coming into this country. Or if you think about nursing specifically, there were times in the nursing history where people like myself, Indigenous nurses, and others could not get into the nursing profession. Those are de jure type of racial discrimination. De facto refers to the discrimination that manifests in real life and in practice, right? This is the one where you might be the only one of what on your unit and nobody wants to help you do your work. Or you might be the only person of that particular ethnicity, and the system is designed to not honor your particular cultural beliefs or what have you not. So de facto is the way in which nurses are treated or perceived treated in their workplace. And so what I will do here is I'm going to stop sharing. Sahar or Khadija is going to come on, and we're going to do a little bit of a group activity here. And just to say that the scenarios in these these case studies are actually your stories. So these were stories that were you were gifted to us in the study, and our amazing research coordinator, Tess, had gone through and created just examples of what de jure racism, racial discrimination might look like. And the reason why we're doing this is we've looked at some other data that we got, and there seemed to be some confusion or maybe misunderstanding in terms of what racial discrimination could be. So if you could use this QR code, and Sahar, Khadija, I think you might have to advance because I can't advance. There we go. Thank you. So if you can use the QR code, log in and start answering some of these questions, it would be amazing. The first one is a registered nurse. And again, didn't make this stuff up. This is based on your situations that you have gifted us. A registered nurse working in a long-term care facility says she heard Black nurses have lower resiliency compared to white nurses. Is this an example of racism, racial discrimination? All right, so we're getting a lot of people saying that they think this is an example of racism. And then, a good number, sizable number of people saying that this is racial discrimination. For the sake of time, I will move on, but the answer here is racism. If you think about it, racism is the ideology that certain people are superior or better than others. So the next question, to a review of the hiring practices found that despite qualified applicants from all backgrounds, only nurses of Filipino descent were hired in the past 10 years. Again, this is based on things that you are telling us that you have seen or experienced in the workplace. And so, a good number of people are saying this is racial discrimination. Exactly. So, again, we are that protected class, ethnicity, nationality is there. People not being hired because, and they have been, in fact, qualified to do the job. So that is definitely racial discrimination. Next slide, please. This one, an Indigenous primary care nurse working in an Indigenous community was told by their manager that they were surprised to find out that they were a real nurse, quotation, non-quotation, close quotation marks. So racism versus racial discrimination. Many of you are saying this is racism. Exactly. Clearly, this manager needs some training or needs to be fired. Next slide. Thank you. A Black nurse is frequently subjected to racial slur by patients. The patients ask the nurse where they went to nursing school, and they say that they don't want the nurse to care for them. The nurse has reported these instances to their manager, but the abusive behavior continues. And so the question is this de jure versus de facto? You're on point, exactly, de facto. There's no rule saying that as a Black nurse, you can't work on this unit, but people have this perception that your Blackness equates to less than or not being qualified, and therefore that fuels their racial slur toward this particular nurse. Thank you. Next slide. The next one is an internationally educated nurse, didn't put the origin, recently arrived in Canada as a landed immigrant. They have been unable to obtain their provincial license. As their home province does not recognize their educational background, they have been told that they must redo their nursing education in order to obtain their license. So is this de jure versus de facto? So this one, folks are probably thinking a little bit about it. And so, if we go back to the definition of racial discrimination, we have those protected or prohibited grounds: nationality, ethnicity, race, color. So one could argue that nurses from that particular origin of a country or wherever it might be, are suffering negatively so because of these licensing practices, and that could be a form of de jure type of discrimination. Next. Another one, an Indigenous nurse was told by their manager that they should get paid less than their non-Indigenous colleagues because they don't have to pay taxes. Again, these are things that you have shared with us. It got many of us shaking our head and scratching our head to say that, we think we're making progress, but people actually are getting away saying things, just insane things out there. So what is this de facto type of, exactly? There is nowhere, it's not written anywhere to support this nurse manager's or this manager's comments. So it is de facto form of racial discrimination. Next slide, please. A visible minority nurse with years of experience recently completed their MBA to get a leadership position. After speaking with another visible minority, they were told that any new leadership position are already spoken for and the job description are tailored to the prospective candidate. So don't even bother applying because they're never going to hire one of us. It's unfortunate, but it's happening. It does happen. And so is this de facto versus de jure? More people are saying de facto, exactly. The rules are not going to say that Black people need not apply, but if you do apply, they will find ways to not hire. And we've seen a lot of these cases in the legal cases that we have also reviewed. And again, if I get a chance, I'll be able to show that to you. But if not, it'll all be included in the report that we hope to be releasing in a few months. So yeah, this is definitely de facto form of racial discrimination. And there has been a case right here in BC that went to court around it. So that's it. Thank you all so much for participating. I will go back to sharing my screen and continue with the presentation on our results. So thank you. Hopefully that was somewhat informative, and I enjoyed talking to you about it. So for the study, our survey, we used several instruments to measure different outcomes that we're interested in. One was the Workplace Prejudice and Discrimination Inventory. This is one that may not be super common to folks, but because of the sort of the foundation of our study around the human rights and workplace experiences, we wanted a tool that spoke specifically to that. Absolutely, there's different tools out there that measure racism, but we felt that this was one that spoke to the concept of racial discrimination that we were after. So this one assesses the workers' perception of prejudice and discrimination, and the highest scores indicates higher perception of discrimination. We also measure nurse practice environment. And the reason we did that was because we know that the practice environment has an impact on the nurses and their ability to care for patients. That association has been well established for 3 decades or so. So we wanted to know how racial discrimination factor into that. And also the nurse practice environment tool by Dr. Lake has been used extensively. And so we wanted to be able to gather our data and compare it to others. And in order to do that, it was important to use similar tool. And then we used the professional quality of life tool to measure things like burnout, fatigue, secondary trauma, and other things. So here are the results of the quantitative part of the study. We had just under 3,600 people respond, and some of them were not registered anywhere in the province, nor some of them didn't meet our criteria in the sense that, registered midwives are not, in Canada anyways, regulated as nurses. So after excluding those numbers, we came to 3,274, just under 3,300 respondents. And this data is from October the 3rd to January 17th of this year. This here is a map representing the country and the respondents. So we had representation across the country, which was amazing. And I will comment and say that, a huge thank you to Mr. Don Fleming from CAUSN in his effort in getting the numbers in Alberta off the charts. So Alberta lead the pack with just 932 respondents. We were hoping for the same across the country, but again, we're just happy that we have representation. And the thing I will caution us about is some of these other provinces had smaller numbers. So their workplace discrimination scores, they seem more pronounced than others. So just to keep that in mind as we're going through the data here. In terms of demographics, so the regulated nurses, over 90% of them were registered nurses as expected. About 4%, 4.7% were licensed practice nurses. 4% was NPs, and like 0.7% was registered psychiatric nurses. 61% of the sample had completed their nursing education within the province where they're residing currently. 65% had a BSN as their initial graduation nursing education, and then 96 were registered in at least one province. Here is the racial makeup of the sample, and 80% of the sample is identified as white, followed by those who identify as Black. And there is a group consistent within our data set that consistently mark prefer not to say. And I'm pointing that prefer not to say, even though they're, small group compared to the whole sample, their outcomes are off the charts. So when you look at that burnout rate, their fatigue, their experiences of discrimination, it's off the chart. And I think that speaks to the fact that this group of people or nurses do not feel safe to even disclose their gender, their race. And yeah, when you look at how they're feeling and what their health status is actually quite shocking. I also will say that we use CNA network largely to recruit. So this might actually be reflective of the CNA membership demographic than it is reflective of the nursing demographic in Canada. But that is to be, we hope that we can do this data for all nurses in the country and be able to answer that question. The age distribution, again, pretty happy with it. Not a perfect bell curve, but again, there's representation across all the age groups. The median age of nursing practice was 20. So this was very well experienced nurses. And we've had focus groups and talking to them, and we get that a lot. We got their experience, came through. The new grad population was just under 3%. We talk in nursing about leadership being of cappuccino effect. And so we tested that out. And those who were in who report being in a formal leadership role, majority of them, 29% were white versus 7% that was non-white. Again, there's a lot of you doing research in this area, so I'm not going to go into detail about it, but we certainly need to be looking at why is it that you have non-white people in nurses in leadership position, but also study the systems that lead to that. By putting folks in the leadership position, non-white people in a leadership position will not solve the problem that has prevented many from getting into those positions in the first place. We asked, so these are self-reported experiences. So we use tools to measure people's experiences of racial discrimination, but we also just frankly asked them out, have you experienced XYZ? And most people said that about 11% of the population said they had experienced racial discrimination in the workplace. 19% said they had experienced sex-based discrimination, and 21% had said they experienced gender-based discrimination, And then about 3% said they experienced sexual discrimination based on sexual orientation. Again, in our sort of statistic analysis, only racial discrimination was significant predictor. I'll talk about that in a minute. Or the tool only picked up racial discrimination, is what I should say. So here are a few graphs just looking at workplace discrimination across the country. And so you see that Alberta has a lower rate compared to the average. So the average is around 52.5. Alberta has lower than that. BC has a little bit above that. And then so on and so forth across the country. Again, as I mentioned earlier, because of the sample size in some of the other provinces and territory, the effect is quite pronounced, but just know that it's sample size driven. We, in terms of nurses and where they were trained, so nurses that got their initial training in the current province that they're in had the lowest workplace discrimination scores compared to those who came here from outside the country. Again, when we're talking about the demographics and all of those things, this is one of those implications for internationally educated nurses and their experiences in the workplace. No, nurses who have more than one license or licensed in more than one province had more workplace discrimination than those who just had one licensed in one province. So race, in terms, white nurses had lower workplace discrimination score compared to the non-whites. And then this is what I was saying earlier about prefer not to say. So folks who prefer not to say had higher work discrimination score compared to non-whites and then white nurses. And this is a very interesting one, and I'm scratching my head about this, but we're doing the qualitative analysis to go with it to better explain it. So nurses with master's degrees have higher workplace discrimination score compared to all the other educational levels. And so in the qualitative data, it appears that career progression might be responsible for this. So a lot of the folks, kind of like what we did in the activity, a lot of folks go to school to go get the education, to move on to a different position, but then they're denied that. So that is part of it. And we're doing further analysis to fully explain that observation. Minority status, and we use minority in a different way in this study, not minority in the way we commonly use it, but minority in terms of numbers. How many people that look like you work with you? And what we found was that nurses who identified as non-minority or minority in their workplace have a higher workplace discrimination score compared to others. I know I'm running out of time. I have 2 minutes, and I will do my best to cover the rest of this in that time. Burnout scores. Again, the more higher burnout, nurses with higher burnout scores had higher workplace discrimination index. Nurses who are working in unfavorable working environments using that tool had higher workplace discrimination compared to those who are working in clinical or in situation settings that are favorable, classified as favorable. Again, perceived scores. Those associations are exactly as we would hypothesize, which is that those with higher perceived support have lower workplace discrimination score compared to those who don't. And then moral distress. Again, those with a low level of moral distress had lower rates of lower workplace discrimination score compared to those who have higher moral distress. So everything considered, the predictors for workplace discrimination and prejudice are listed here for you. Race came out as a significant predictor. And some of you may know that I wrote a paper that says race is not pathological, that racism is. And when it is significant predictor of outcome, it's an indication that racism is at play. I would probably extend that analogy and say this is an indication of racial discrimination that is evidence in that particular data. So I think what our data here is saying that racial discrimination is happening, and these are the different additional predictors of nurses' experiences. So what are the next steps? Where the qualitative data is enormous, so we're working through that to be able to further explain the quant data. We want to be able to identify some strategies, and then we have reports, a final report that we're currently working on, and hopefully we'll get another opportunity to have a conversation, a more fulsome conversation about this. But if not, feel free to send me an email, and I'll be happy to get on a Zoom call to talk more. I won't have time to get into this, but what I do want to do is acknowledge the team that we do have. It's been an amazing team. Mike, which was the ex-CEO, has been tremendous support and continues to support us in this work. Dr. Chantel Bailey has been great in helping us write the proposal and then the report. Tess has been amazing. We have several nursing students, and a nurse from Paris is a nurse from Alberta, and Dr. Richard, who is a biostatistician that helped us with the data analysis. So I will stop there because I'm out of time. And thank you, Valerie.
Thank you, Dzifa. And to be honest, there's so many questions, and I think we're going to just allow a little bit more time for you to have an opportunity to respond to some of them. And Khadija is going to pull up the ones on Mentimeter first.
Okay, thank you. I have to say that I have never done a study in which people are just so grateful. With all the 30,000 respondents at the end of each survey, people are just saying thank you for doing this work. So thank you for trusting me to do this work with you. Did the nurses share their experience of racism in the workplace, mention whether or not perpetrators were reprimanded? No, yes, they said they were not reprimanded. And that last slide that I had about, is it best, would you rather prefer a racist boss versus a racist coworkers, was getting at that, because the data, because there is sort of overwhelming responses from the nurses that nothing was done. I had contacted a human rights and labor lawyer to talk to them about what exactly is happening here. How can this be happening to nurses and there's no action being taken? And essentially what we ended up doing is doing a review of the labor laws across the country. One of the reasons is that nurses are unionized workers. So oftentimes when they try to escalate their concerns, like through a legal means, let's say, for example, they are denied. I understand that that has changed with a case that came out of Manitoba, I want to say, in 2021. So likely all human rights tribunals will be hearing cases from unionized employers. In BC has been acting a bit differently. They have been hearing cases from unionized nurses, and we've gone through the BC case file to see what is happening to nurses. So I can share more about that with you, but essentially nurses' cases have been denied mostly because they have exceeded that 1 year time frame. So there's 1 year limitation that if you want to file those human rights cases to take your case forward. The other issue nurses have also faced was that they have not been able to establish the nexus, which is that I'm a Black woman, I apply for a job and I didn't get that job, I have to establish that it's because I'm Black. And we know the racism is subtle. So how do nurses do that? There was an interesting case here in BC around a Black nurse who applied for infection control job and multiple times didn't get it. And the court appeared to be applying the rule in their favor. But when we went through the case file, we couldn't figure out what happened, what was the last outcome for them. So long answer, but yes, it hasn't been addressed. And in the court system, nurses are facing challenges in establishing the cases.
Thanks, Dzifa. So there are so many questions and we still have to go to break. So I'm thinking maybe two more. And if people do have
Sure,
to
and I'll
run
keep
out
the
for a
answers
bio break,
short.
yeah, yeah, no, that's great. And definitely it just shows that we need to continue to engage in these conversations. So thanks so much, Dzifa.
Absolutely. So it's always very, very difficult to articulate what is happening, experiencing. Can you offer any advice on how one can work through the process? I will suggest, so we did, Tim and I and Damiola and Carice did a presentation for healthcare leaders this past summer. And what we found in that presentation is they are also lacking the knowledge and the what to do in these situations. So one of the leader has said, you know what, this case, the study that you're just presenting, I have seen many of them. Many people, nurses have come to my office saying this, but what am I supposed to do about it? So, I think upper management needs to be educated around these things. I think we also need to have folks who are truly trained in HR experiences and trained in the human rights and know what the threshold is, right? There's certain things that we shouldn't be playing around with. If somebody say they're experiencing racism or racial discrimination, believe them and investigate it. But oftentimes people shove it under the door or they ignore it. I always say, if somebody comes to you and say they were raped, you would just take it, you would believe them and you would investigate it. The same should apply to when somebody says that they have been racially treated and unfairly so. So that is just my personal opinion. As a minority educator, what resources are available? The workplace is so difficult, the union is difficult to deal with, and it's very disheartening. So yes, that question was also asked in our study in terms of, has the union been supportive to you when you have had these situations? And it was split. A third people said no, others said this doesn't happen, others says that yes, they were helpful. I think, again, this goes back to those contract negotiations that folks do, making sure that there's language in that contract to say that if a member has concerns around racial discrimination, this is what we're going to do. And the same should also apply. If a member is accused of being discriminatory, there ought to be some steps to be taken to ensure that that behavior does not continue. So I will stop there, but like I said, we have a report going and I hope CNA will give us another opportunity, not just me, but our team, another opportunity to have a more fulsome conversation around this.
Dzifa, you shared your research with me only about a month and a half into my new role, and I just want to thank you again. Every time I hear what you're presenting, I just know that we have to continue these conversations, and like you shared, we have to ensure that every leader in the healthcare system has a deep understanding of, what racism is and understands what human rights code violations are in particular. So I'm sure all of you really enjoyed this insightful presentation and the engagement session. I know the exercise to differentiate between racism and racial discrimination and the de jure and de facto assessment of real life examples was very compelling. And it should be actually integrated into every curriculum across the nation and in every onboarding and orientation in every organization. So thank you so much. Thanks for your leadership, your expertise, and CNA is committed to supporting in any way possible and being a continued partner.